Good morning. I am Dr. Ravi Narayan, an orthopedic specialist who has recently joined Naseem Rabeeh Rayyan branch. This branch has been recently started with all the medical specialities, and I am in the orthopedic department, and we are trying to cater to all the orthopedic needs of the local population. I welcome you all to this live session on Facebook, and today I am going to talk to you about back pain, low back pain in particular. As we all know, it's a very common condition. In an introduction, let me tell you that back pain is not an illness, it is a symptom. When any person gets low back pain, it means something has gone wrong in his lower back. We have muscles, we have bones, we have tendons, we have nerves, we have the spinal cord, and all these can undergo certain mechanical stress, some loading effects over there. We can have certain diseases which are seen around this region, and invariably because of this we get back pain. Many of the times the problem is a very trivial problem. You have the back pain for a certain duration of time, say a day or two, and it usually gets better. It's only when it gets beyond those 2 or 3 days do you need to get a little bit worried, and sometimes you may have to meet your doctor who will do the needful. I feel that back is a growing problem these days. What do I mean by a growing problem? As we all know, the evolution of man, we all evolved from monkeys. Monkeys were 4-legged animals, and as you all know, monkeys never get back pain. And then we evolved from 4-legged to a 2-legged man. That is what we are today. And our grandfathers or maybe our forefathers who were 2-legged, who used to move around and do all their work, they used to walk to their fields, they used to go to fetch water, walk to fetch their food, and they used to do a lot of walking. They never used to get so much of back pain, and if at all they were getting any back pain, it was mainly due to some injury, some fall, but never to the condition that we see today. And today we have moved from a 4-legged to a 2-legged, and today I would call as if we are a no-legged human being. Why do we mean by low-legged? We hardly walk these days. Many of us are always sitting on the table and chair. We lead a sedentary lifestyle. We spend many hours in our car driving. We drive long distances these days. We travel in flights for long distances, 8 hours, 9 hours flight, and we sit for a long duration of time. And it is all during whole time that your back is getting the stress. The muscles there are getting strained, and this has become the most commonest cause of back pain. So the evolution has its role. We are now today sedentary. We use our laptops, our desktops, spend a lot of time on our mobiles using WhatsApp, Facebook and other things, and I'm sure it is going to have its toll. I see a lot of clinical situations in my day-to-day practice which tells me why this problem is also growing. Let me cite you certain examples. A driver comes to me telling me that I have been driving all these days, but today when I drove for about 2.5 hours, I could hardly get down from the car. I had a severe back, and I thought it may disappear in a day or two, but it's been 2 or 3 days now. The pain is not subsiding. Then I come across another situation wherein the person tells me that when I was in bed in the night, when I went to the bed in the night, I was very comfortable. When I got in the morning, I had severe back pain and stiff. Until I could get down and move around, the pain did not disappear. Let us come across to another situation who says that yesterday when I lifted a heavy object from the ground, when I was lifting it, I had no problems, but when I lifted it, I think it was too heavy and I had a catch in the back, but somehow I managed it. I went home, I took rest, and when I got up today morning, I am having severe pain in the back, which is radiating down my buttocks and then going down my leg. This is a typical situation wherein a patient may be having something very severe. When the pain goes down your leg, when you have numbness, tingling, it becomes a little bit more serious problem. I also see many elderly ladies these days. As we all know, our life expectancy is increasing. More and more people are crossing their 80s and 90s. Good health care, and moreover, and because of this, not only that, when we grow older, the bone loses its calcium content and other minerals, and then it has its own toll. And these are the ladies who come and tell me that, doctor, I have been having a pain over my mid back and sometimes the lower back, and I noticed it, and when I asked them how long has it been there, I think more than 2 or 3 months, but I feel it is increasing, and even now, even if I take rest, the pain doesn't seem to be going over. Well, we are dealing here with some different causes of back pain which we see in the elderly, which I contribute them to osteoporosis, osteoporotic fractures, osteomalacia, a different type of disorders. I will tell you about them in the due course of my talk. Then I also see young people who are active in sports. Let us say a child or an adult who is taking part in football. He has a nice game in the previous day, sleeps and gets up in the morning with a severe catch. So these are all the various types of clinical situations we orthopedicians come across in our day-to-day life. People who are working in the construction industries, who stand a lot during the daytime, nurses, drivers who drive for long hours, taxi drivers often get back pain. So it's more common seen in them also. Key points after the introduction: back pain is a symptom and not a disease. Active episodes of back pain, although they are unpleasant and awkward, they usually get better quickly. Back pain affects 80 to 90% of the individuals of the population at some time or the other in their lifetime. Now let me go through the little bit about the anatomy of our spine. Our spine is a engineering marvel. It has got bones which are stacked one above the other, and since I've talked to you about low back, let me tell you that we have got 5 bones in the lower back, which we call them as the lumbar vertebrae. They are sitting one on top of the other, just like we have slices of bread in a packet of bread. Each bone is connected to the top bone or to the lower bone by joints, which we call them as facet joints. We have ligaments in front of the bones, we have ligaments at the side of the bones, and then we have ligaments at the back of the bones. Ligaments are soft structures, and in between 2 bones we have another very soft structure which we call as a disc. You must have heard of disc prolapse, disc problems. Well, disc is a soft structure which has got a hard annulus, which is a hard cartilage structure, and a central part which we call as the pulposus, which is a soft jelly-like substances. And many times this causes us problems. And why God has given us this disc and these ligaments? That is the reason why our back is flexible. We are able to bend, we are able to flex. And since the lumbar spine does most of the bending and twisting in our body compared to any other part of the spine, it is this region of the spine which gets most commonly involved in back pain. It also, the vertebral column also holds the very important structure which we call as the spinal cord, which brings down the nerves all the way from our brain down, along with it the nerves, and in between 2 vertebrae, wherever there is a gap, and through this gap we find the nerves which come out. Whenever we have any injuries, when a person gets involved in a severe road traffic accident, and if he has sustained an injury to his lower back, or we have a person who has had a fall from height and has sustained injury to his lower back, it is the lumbar spine which usually gets fractured. And many times, if the spinal cord is involved there, the person can get something called as paralysis of both the legs, where the spinal cord is involved. Fortunately, many of the back problems that we see in our clinical practice do not involve the spinal cord. It just involves the nerves or the muscles and the ligaments around the thing. So we are very fortunate in that way. It's only the mid spine or the neck the back or the upper spine, where the spinal cord is involved in many of the diseases. Now I will discuss to you about certain common back problems that we come across. And the first and foremost, I would like to tell you about something called as a non-specific back pain. What do I mean by non-specific back pain? Many times when the patient comes to us with back pain, say for duration of 1 or 2 days, and we do an examination, we just find that there is some tender spots over the lower back, and the region which is there behind the skin are the muscles, the ligaments, the tendons, the nerves, and we are unable to identify many times as to what is the structure which is involved in this type of back pain. We label this back pain as a common term as a non-specific back pain. Most of the time this back pain subsides within a few days of time, and the patient usually recovers fully. Many times they may even have recurrence, but then it is not a problem which we are worried about. Let us discuss about another common back pain problem, which we call it as the disc prolapse or a disc clip, which was called initially. I feel a disc clip is a misnomer because the disc does not slip from its position. The disc is always there, but over a duration of time, as the loads which gets accumulated on the disc, if a person is a manual worker or a person who sits for long duration of time, so this always gets its pressure over a period of time, and slowly the disc, which has got a good hydration, good water content, loses its water content. It gets degenerated, it gets dehydrated, and it gets damaged. And when such a person has an acute episode, by acute episode I mean when you are traveling in a car and suddenly your car takes a jump over the speed breaker, or you are traveling in a bus and we have a jump, and then there's sudden pressure on this disc which is already damaged previously, it can get hurt and it can leave its place there and can protrude and hurt the nerves which come out. This is called as the disc prolapse, very commonly seen in young individuals, unlikely to be seen in very children, and in elderly persons also we don't see, we see some other conditions. Disc prolapse is really common in the middle-aged group, especially people who are more active, who are involved in heavy manual work, heavy activities, driving a lot. Okay, then the nerve roots which come out from the bone, they supply the muscles of the limb. They are responsible for our movements, and they also take back the sensations, touch, pain from our limbs back to the brain. So the person who has a disc prolapse complains of pain over the back which goes radiating down the buttocks and back to the leg. Okay, severe pain. He describes it like something like tingling, numbness, something weird, something severe pain, severe catch in his calf muscles, and he has difficulty in getting out of his bed, difficulty in sitting, or difficulty in getting up from a sitting position. So this is what a typical patient with a disc prolapse will come. The doctor examines him, tries to identify what is the lesion based on a clinical examination, does a neurological examination, and we try to find out where is the lesion exactly. Most commonly we get disc prolapse between the 4th and the 5th lumbar vertebrae, and sometimes between the 5th and the S1, that is this first sacral vertebrae, L4, 5, L5, S1. These are the most common disc prolapses that we commonly encounter in our clinical matters. Many times patients come with difficulty or inability to dorsiflex their foot, or sometimes difficulty in extending their toes, which we find out during a clinical examination, and these are the cases that we are worried about. Spondylosis, this is another condition, and all of us, spondylosis is nothing but wear and tear. In the neck we call it as cervical spondylosis, and the lower back we call it as lumbar spondylosis. We drive your car, your tires get worn out. We live long years, we do a lot of activities, definitely our back also undergoes its normal wear and tear, and this is also a common cause of back pain. We call them as lumbar spondylosis. This pain usually is there for a certain duration of time. The pain comes, goes. Usually these are elderly people for obvious reasons. It's wear and tear, we see it in the elderly people. So lumbar spondylosis is more common in the elderly people. Occasionally we teach them, we provide them some analgesics, we teach them some exercises, and many of the patients get better with some simple treatment, or sometimes some sort of physiotherapy we give them. If we do an X-ray examination, many times what we see is there might be certain bony projections, which we call them as spurs or osteophytes at the end of the vertebrae. Sometimes we find a small reduction in the disc space, but other than that, no other findings are seen, or some facetal joint arthritis. So these are the various causes for spondylosis. Lumbago is an acute condition when a person has severe pain in the back, which usually lasts for a day or two. We call it as acute lumbago, and it is because of some muscle or ligament which is injured, and it gets better sooner. Nothing to worry about. Another condition called coccydynia. Coccyx is the tailbone, the last bone, the bone on which we sit. Who are these patients who get coccydynia? I will give you certain examples. I have been riding a bicycle yesterday evening. I rode for about 20-25 kilometers. And after I got up today morning, I am having severe pain with the tip of my spine. I had a fall in the bathroom today. I had a fall over the steps, and I hit my backbone, the tip of the backbone, and it has been paining. So these are some causes for injury-related coccydynia. We get some other patients also who have coccydynia. These are people who are sitting for long duration, people who sit in flights for long duration, 7 or 8 hours, constant one particular position. They can get pain over the tip of the coccyx. People who sit on the ground and do their household activities, sitting on the ground and cooking, or sitting on the ground for long duration for prayers, they can get coccydynia. Coccydynia is pain over the tip of the spine, and it is usually a self-limiting conditions. Simple medications are more than enough. Sometimes we resort to, for intractable coccydynia, we sometimes give some steroid injections there. More important these days, osteoporosis, osteomalacia. These are compression fractures of the bone, which I was telling you in my introduction. The elderly ladies who present to us. People are now living in their 80s and 90s. They are getting older. Life expectancy is more. They suffer from something called as osteoporosis. Commonly seen in post-menopausal women who have completed their cycles. We call them post-menopausal. What happens? There are certain hormonal changes. The bone loses its normal calcium content. There is more loss of bone than regeneration. Not only calcium, there are other minerals, magnesium and other things which are also lost. The bone becomes weak. It loses its strength, it loses its integrity, and trivial acts like, say, just lifting an object or lifting your bed or just pushing your table or lifting your table can cause certain fractures. Many patients now are indoors. They never expose themselves to sunlight where natural vitamin D can be synthesized. Elderly women always remaining indoors under the effect of AC. Well, these are the patients who can get osteomalacia. Osteoporosis, osteomalacia, these are the diseases of this era. People are living for long years. We are going to see many of these patients, and these are the patients who have got pain which is there for a long duration of time, 2 months, 3 months, and the patient typically tells me that it's not related to my bending or working. Whenever I bend, the pain is more, but even if I am resting, I get this pain. This pain has been increasing, doctor. What is the cause? What can you do for me? And when we examine them, many times they don't have any neurological problems. They just have tenderness, vague pain over the back. Sometimes they do present to us with something called as kyphosis. There is bending of the spine because of multiple fractures. You can get lateral bending of the spine, which we call as scoliosis. We can get congenital causes and acquired causes of scoliosis because of this osteoporosis. Both of these conditions cause intractable, chronic, long-term back pain. We need to examine them properly, we need to investigate them properly, and we get x-rays very regularly in these conditions and manage them with the help of medicines, analgesics, calcium supplementation, braces. And today medical technology has come to such an advanced stage where if you have one particular bone which has compressed, which has collapsed a lot, we put a cannula from the back, inject cement into that, something which you called as vertebroplasty, and can expand compressed bone. But remember, this is done for a very few select cases. which we have ruled out other causes, not done multiple fractures, which sometimes we select, and they do get dramatic relief in their pain. Vertebroplasty. Now coming to treating back pain, the first steps. If you have a back pain which has been there for the last 2 or 3 days, which is not subsiding, it's troubling you, and you feel that something more, it's different, it is more than what the usual type of back pain you are getting, you have tried over-the-counter medications like paracetamol, or applied some local gels, hot water fomentations, sometimes even cold water fomentation if you had a small twist or catch, but it's not subsiding, then you need to see a doctor. And the doctor, what will the doctor do? He'll first ask you, since when it has arisen, how did it arise, what happened, did you lift any heavy objects, what is the duration of this pain, where is the pain, where does it go, does it remain at a particular spot. He may ask you many various questions. He may also ask you, especially in case of chronic pain. Chronic, when I say that pain has been more than 2 or 3 months, or when I say acute pain, it is usually less than a month, less than 1.5 months. Subacute, 1.5 months to 3 months. And any pain which is there for more than 3 months, we call them as chronic back pain, persistent back pain. So when a person presents with persistent back pain, we need to be more careful. We have to identify, we need to investigate them properly. But if you have a pain which is sudden in onset, it has been there for the last few days, troubling you, let me tell you that you don't have to be very much worried about this pain. This pain will slowly subside. You don't have to worry much. This is not those pain which we need to be worried about. But those chronic back pains which have been there for long duration, you may have features like loss of weight, loss of appetite. Sometimes you can have even loss of bladder control or your bowel control. The nerves which supply our bladder and the nerves which supply our anal canal, the bowel, are coming from this lumbar spine. These nerves are involved in certain disease or trauma. Your bladder can be involved where you may have incontinence of your bladder, you may not have any control while passing urine or no control while passing motion. These are the conditions where we need to be very much worried, and these are usually slow arising pains, not acute pain. So acute pain, good outcome. Chronic pain may not have good outcome. You may have to investigate and find out what is the real cause for that point. So the key points after this condition which I spoke to you and treating back pain, the first steps are: most back pain is simple back pain. A small proportion of people have sciatica and a few have got more complicated problems. Simple back pain usually responds to pain relief medications. A short period of rest if necessary is necessary, and early physical activation and return to work is important. If your condition fails to improve, you may need to see a therapist or a specialist, an orthopedic specialist, who may undertake further investigations and treat your conditions. Now I am going to talk to you a little about how to protect your back. We always say protection is better than cure. Prevention is better than cure. Let me see how you can protect your back. Especially for those people who get back pain very frequently, we need to follow these instructions. Not only them, all of us, we need to follow these instructions. Improve your posture. When you stand or when you walk, always walk erect. Try to keep your head, neck and shoulders as erect as possible. Avoid stooping or slouching. This causes a lot of stress over the back and it can cause back pain. You can see many elderly people walk like this. It is because of their osteoporotic bones they cannot avoid. But if you are able to avoid stooping and you are able to walk straight, always good. Always walk with a straight back. Sitting at a desk. When you sit, always try to sit. Always see to it that you have a desk which is of a table which is of adequate height, a chair which has got good ergonomics. Your back should be nicely touching the back of the chair. The hollow that we have here, sometimes you can keep a cushion or a rolled towel to support your back. That is very important. You always sit to the edge of the chair, sit erect as far as possible. Avoid stooping over the back, over the table. Always have a table which is of adequate height. If you are standing and doing certain works, when you stand, let me give you an example. You always stand to do ironing early morning, the height of your ironing stand should be at this level. So when you stand, the height is at a different level, and when you sit, the height of a desk is at a different level. So when you stand and work, suppose you're working in an assembly unit in a factory, or you're working in your house ironing your clothes, your iron stand should be at the level of your hips. Then you can be able to iron comfortably. Your back should be straight when you iron. Avoid bending and ironing. Avoid a low couch and ironing. This is going to cause back pain, and you're going to have frequent back pains. Let me give you another example. A lady in a kitchen who is washing her utensils. The ideal height of a sink should be at your hip level. If it is at the hip level, you are able to wash your utensils without bending down. Very important. We see a lot of housewives, a lot of ladies coming with back pain. When you ask them, you find them they are stooping. We need to have a good broom which has got a good height, or a mopping machine which has got good height. So avoid bending and mopping. You should always try to mop, keeping your back straight. So these are a few instructions that you need to follow. Examine your shoes. Well, I have a special instructions for those women who get back pains very frequently. If you are going to wear a high-heeled shoes, when you walk with these high-heeled shoes, your lower back trips forward, and in order to compensate it, the upper back goes behind, and because of this maneuver, your back takes a lot of stress. So obviously, you are going to get back pain frequently. So if you are a woman who is getting back pain frequently, avoid high heels. And also, shoes should have a good sole, soft sole. Avoid hard leather soles, because whenever we walk, when we propel ourselves, the shock waves are transmitted from the ground through your shoes and to your back. So back takes a lot of brunt. So good, soft, high heel shoes are always good for walking. And you have to always sit correctly. When I just demonstrated, avoid easy chairs, avoid armchairs which are low lying, avoid sitting and watching TV like this in your sofa. Many people sit like this and watch television for long hours of time. Not good. Or they rest their neck at the edge of the sofa and watch TVs for long duration. Well, you always end up with severe back pain frequently. So avoid them. The rocking chair which your grandfather uses, also not a good chair. It always brings about a lot of patients with back pain. So these are the few things. What about the seats in your car? A lot of car manufacturers have done a lot of ergonomics on this aspect, designing chairs, designing your seat in your car. Ideal car should have a seat which is height adjustable and lumbar support adjustable. These are very important things, and all the luxury cars, the high-end models, always have this type of seats. Avoid cars, low-lying cars, if you have to travel long distances, because they are going to be a problem. If at all you have to travel a low car and you have a back pain, use a pillow. Just keep a pillow there and sit on a pillow. Then you can avoid the chances of you getting a back pain. So there are a few points which I told you about how to sit, how to stand, how to walk, how to what type of iron table you need to use, what should be the height of the table. These are very few good instructions, and not only for patients who are suffering from back pain. I think they are applicable for general population in general. Now let me also demonstrate to you how to lift a particular object. Now I have a dustbin. When you have to lift a particular object, first it all depends on what is the weight of the object, what is the size, what is the shape, and what are you, whether you are a healthy adult or you are an old man. So once you have know that yes, you are able to lift it, you avoid many people try to bend forward and lift this. Now see what is happening. I am bending my back and I am putting a lot of stress on my back. This is going to cause a lot of stress on my back, a lot of mechanical stress, and invariably I am going to get back pain if I go on doing this repeatedly. What is the best method to lift an object? Go to the object as close as possible. Keep your legs wide apart. They should be at least about 90 degrees apart. Okay. Now see what I do. I bend my hip and my knees slowly. See, I'm bending and keeping my back straight. If you have to stoop your back forward while doing this, no problem. Your back can stoop. Okay, but your back cannot bend. Hold the object. Keep it as close as possible to your body and lift it. So this is the correct method of lifting a heavy object. And how do I keep it? Again, do the same thing in reverse. Okay, so this is the method we use to lift an object, and this is taught to many people who work in factories, and this is called as the kinetic method of lifting an object. A very important method, and all workers who work in industries should keep this in mind. Now let me talk to you about something about back pain and sleep posture. A lot of people get back pain in their bed. Now I'll give a few tips about what type of bed. I have a person here who is going to help me in telling you what is the ideal method of sleeping. Ideally, when I ask many patients who complain of pain when they get up of their bed, I ask them, what is the type of mattress that you have? Is it a very soft mattress? And many times they say, yes doctor, it is a cotton mattress and it is sagging in the center. So a sagging mattress, a cotton mattress is not an ideal mattress. An ideal mattress should be firm, okay, well sprung mattress, but many times these are expensive. And the best method to cut down the cost is to get a board, a wooden board which is about say 3/4 of an inch or 2 centimeters in height, and it should be the whole length of the bed. A firm, proper mattress, okay, which is not hard, is an ideal mattress. It should not be sagging. And some people ask me, doctor, if I sleep on the ground, will my back pain get recovered? Never, never, never. But the ground is it's a very hard bed. Once you sleep off it, you are very comfortable, you won't get sleep at all. So I never recommend hard beds for my patients. A firm mattress is ideal and it should never be sagging. Either you lie down in the supine position. This is how this person is lying. You can either lie, let me show you. You can keep your hands below the head and lie. This is one of the positions in which you can lie, okay? Or if you need to use a pillow, many people use a pillow, you can use a single pillow. Okay, so I have kept a single pillow. Now you will see the head, the neck, the body are all in one line. There is no curvature, there is no bends. So this this type of people will never get back pain. Now let us assume that he is now lying down on the sides, which most of us do. We always lie down on our sides. You lie down on the sides. Again, try to see that your neck, your head, neck and the body is straight as far as possible. It doesn't matter whether you are folding your legs or not. You can fold, but this part should be as straight as possible. And always use a single pillow. Now just see what happens if I were to use 2 or 3 pillows. The second pillow, and then many people like to use a third pillow. Now see what happens. Now he is lying with a bent neck. He is going to get up in the morning with severe neck pain and obviously some back pain. So never use more pillows. I always advise my patients to come with neck pain or back pain. Avoid pillows if possible. Or if at all you have to use a pillow, please use one single small pillow. Or you can just put your hand over the back and sleep, or you can sleep over with your hand in this position. That would be the ideal position. And when we sleep, when you already fell asleep, it is very difficult to control our position, whether we are lying straight or we are slightly bent. The best thing that you can do is get up in the morning and do some exercises. So without exercises, it's very difficult to see that your back pain is, you don't recover from back pain. Stay in shape. Well, if you are obese, you are put on a lot of weight, that much extra load is there onto your back. Definitely it is going to hurt, it's going to cry. So if you are obese, you have to find ways to reduce your weight, and definitely your back will be very happy if you reduce your weight. Exercises, a very important part in managing back pain. When a patient comes to me with back pain, after assessing him and finding out the cause for his back pain, whether it is a non-specific back pain or a disc patient or spondylosis, I always teach my patients certain exercises. These exercises are called as spinal exercises, and we divide them as flexion and extension exercises. Certain exercises are contraindicate certain diseases, which your doctor will tell you. Okay, the flexion exercises and the extension exercises. The flexion exercises help you in strengthening your stomach muscles, and the extension exercises help you in strengthening your back muscles. If your muscles are strengthened, are healthy, you are unlikely to develop back pain, and you can sleep in whatever position you like. It is very difficult to control our position once we are asleep. Many times your wife will tell you that when you ask in the morning how was I sleeping, she'll tell you till you are about to sleep you were sleeping in a proper position. When you got up in the morning, during the night your position was awkward, I was getting hurt. So you find that you always keep changing the position at night. Many of us do it. So the best thing is to exercise every day early morning. There is no substitution for exercises. So the key points here: good posture is important for preventing backache. The shoes that we wear and the chairs that we sit on can also affect our back. Avoid sagging chairs and high heels, sagging beds. When lifting an object, follow the kinetic method of lifting and avoid lifting very heavy objects. Make sure that your bed has a good, firm and a comfortable mattress, and avoid use of too many pillows. In the end, I would like to talk to you about a few of those chronic conditions which we come across, and one of them is persistent back, which we call as persistent back pain. Chronic mechanical back pain due to lumbar spondylosis is because of the wear and tear, and since the wear and tear it cannot go back. These patients are going to have back pain very frequently, and we provide them, as I told in the beginning, analgesics which are safer to take over a long duration of time. We teach them exercises. We sometimes give them braces, belts for short duration of time, and they overcome properly. Another condition called spondylolisthesis. Spondylolisthesis is a condition wherein we have one vertebrae which slips over the lower vertebrae. Why does it slip? It slips because there is some defect in the hook mechanism there at the back. Either it could be degenerations, and sometimes we get some congenital conditions where we get listhesis. So listhesis is another condition where we get chronic persistent back pain. What about any infections? Yes, these infections are called as discitis. Very uncommon in this area of the globe, but in my country, tuberculosis infection is a very common condition which causes low back pain. Tumors. Primary tumors over the back are rare, but secondary tumors. What I mean by secondary tumors? Malignancy somewhere, say for in the lungs, or in the colon, or in the cervix, or the uterus, or in the liver, can many times metastasize to this bone, send in certain cells there, which we call as secondaries, and this is a very commonest cause of persistent back pain, which are very worried. These patients have got loss of appetite, lack of they lose weight, there's loss of appetite, and we need to investigate them properly and manage. So these are other conditions, and the condition called as fibromyalgia. This is a person who has got multiple tender spots over the back. The SI joint is painful, and this pain is there for a long duration of time, and many of them have got certain psychological problems. So depression could be associated with fibromyalgia. We accordingly manage these conditions. So these are very other conditions which causes back pain. I think I have covered most of the topics. We also see young women who come with back pain, who have got certain infection, which we call them as pelvic inflammatory disease. These are young girls who after their periods have certain discharges, white, yellow discharges, and they also complain of back pain. Back pain during periods is different, whereas the pain persists after the periods are over, and then they do have certain conditions called pelvic inflammatory disease, which we do see sometimes. So these are all the causes of the low back pain which are narrated to you, in addition to the injuries. I have not included injuries, trauma, fractures. They are all separate causes. They are very obvious causes, but these are other causes of low back pain. In the end, I would again emphasize on exercise. Exercise is a very important method, very important tool we have to overcome our back pain. The simplest exercise is just plain walking. If you are able to walk 5 kilometers a day, an average individual, I am sure you should never be able to get back pain. If you are able to do if you are not able to go out and walk because of weather conditions, you can do certain stretching exercises at home. Yoga today, a very important form of exercise which people are doing and learning overall throughout the day. Today we have a yoga day too. learn yoga, do these exercises, do these asanas at home in the comfort of your house, and I'm sure you can lead a back pain free. So I end this talk. I always whenever I send my WhatsApp messages, when I wish them birthday wishes, I say happy birthday my dear friend, keep exercising, keep fit. So this is what I would like to end. Many of the back pain, 80-90% of the back pain can be managed by just simple exercises. So only about 10% which need further evaluation and management, which we are here to help you out. So if you have any comments or any suggestions or any queries, please post them on live. We will try to answer them. I hope you have enjoyed my talk, and I hope to, if at all if you have any serious problems, you can always come here. We are there to help you. I am at Naseem Al Rabeeh at Al Rayyan branch. Thank you.